Hi, welcome back. Wow, this has been such a great day for so much information. I've learned so much, and I appreciate for our attendees. This has been long, but good and worthwhile, I think. I hope you feel that way too. And I just want to assure everyone that there's been a lot of information here to absorb, and this once we do a little bit of post editing, this whole forum will be posted on our website so that you will be able to come and go through the parts that were important to you and get the information that you need. We are also always here, so please, at any time, if you have questions, concerns, you want information about some of what you've seen today, you might see support educational tools that we've talked about today, please write us at info@kidneycancercanada.ca or call us at our kidney cancer, I'm going to forget the number, 1-866-598-7166. So it is on our website. Please don't hesitate to reach out. And if you are newly diagnosed and you want some support or information, we're here to help. And for those that have been on your care path for a while now and may be facing new challenges or just need extra information, we're here to help you too. So please don't hesitate. I just want to let you know that we will be having our coffee chat coming up this coming week. So please join us. You can register, join in on our website. And it's a great session. It's a private place where patients and caregivers can come and discuss some new treatment options, difficulties they're having. We're all in the same boat. We all understand. So it really is, it has become one of the best things that Kidney Cancer Canada has undertaken and maintains. Some of us have been there from the very beginning and we're almost like family. So I invite you to join us and see what we're about. And if it's not for you, I understand, but please try us. I would like to now introduce our board chair, Andrew Weller. And Andrew, hopefully you can join us. And Andrew did this excellent presentation at the International Kidney Cancer Coalition Forum in Argentina recently. So I think you're going to enjoy it. It was very informative for me when I first saw it. And I welcome Andrew and thank you so much for sharing this with us.
Thanks, Christine. Can you see the slides?
I can. All ready to go.
Okay, great. Oh, no, it's not changing. So as Christine mentioned, I'm going to talk about survivorship. Before we get into that, we probably need a bit of a level set on what is survivorship. There's tons of definitions out there, different organizations, different healthcare organizations, and the internet always has different ways of describing things. But this definition here from the NIH, or the National Cancer Institutes, which is part of the NIH, kind of summarizes all of them into one concise definition. So survivorship in terms of cancer is from the time that you're first diagnosed all the way to your end of life and all those activities in between. It says stop sharing.
Sorry, Andrew, now I can't see your slide. So there you go. Thank you. It's good now.
I haven't touched my computer, so I don't know why they stopped.
I don't know what happened there. I don't know. Thank you.
No worries. Hopefully I can switch slides without. So anyways, so survivorship, it's your total journey. It's your health and well-being of a person from diagnosis to end of life, as I sort of mentioned. It includes your physical, mental, emotional, social, and financial effects. So all the great speakers we've had today have sort of talked about the treatment options, some post-treatment things with adjunct therapy, things like that. But survivorship expands that. It's your whole life being after the time that you were diagnosed. So again, we talk about the mental, physical, emotional, and it gets in all the way to the follow-up care. So if you have late effects, so we all hear about side effects during your treatment. but sometimes there's side effects that don't materialize for a year or two, or maybe 5 years later. It could be a second cancer or a recurrence of your current cancer. So there's that whole quality of life after diagnosis. But survivorship also takes into account those important relationships in your life. So your family members, your friends, your caregivers, because they all are part of your ongoing journey after you were first diagnosed with cancer. Did that change? Just check. Are you still seeing
Yes,
this?
sorry. Key factor for care?
Right.
Perfect.
So from survivorship, one of the things is they talk about what are the key care factors. So I look at one of the key definitions from the Institute of Medicine describes patient-centered. And you've heard a lot of the doctors and healthcare professionals today talk about patient-centered and patient-focused. This is the new way that the healthcare profession are bringing in the patient and the caregiver's journey decisions into that whole care treatment. So when we talked about decision aids, when we talk about different options for surgery or different medicines, different regimes, different options. So it's patient-centered, bringing the patient involved in that. And that's one of the most important factors in achieving quality care, because the patient's involved, so the quality is going to be better because they're part of the decision, they're part of the direction that your care is going to take, how it's going to be delivered, where and why it's going to be delivered. So you should, as a patient, bringing in your caregivers, you should include things. So your preferences, making sure that you have all the information you need, that you seek out education and communication, not just from your primary healthcare providers, but from other sources, just like you're here today with Kidney Cancer Canada. And then you need to coordinate your care and ensure you have access to care. From some of the research done either by the IKCC, Kidney Cancer Canada itself, or other organizations, there's slightly over 50% of the population of patients and their caregivers are shown to have fully understood their treatment options or the recommendations. So this is really key that you're involved and that there's a survivorship plan going forward. So what are the factors involved in overall survivorship? So obviously the big one is your stage of cancer, and is it local and metastasized? So are you going to need surgery? Are you low risk? Are you high risk? Or will you have some kind of systemic treatment regime that's going to last months or years? Who's involved in your overall care plan? So again, I mentioned the family and your caregiver involvements. This will take a big part of how you're going to go through the journey and how you're going to be involved in your treatment, because your family and your caregivers may need to drive you to appointments, so they may need to track certain facts that you're given in those appointments because you may miss some of the key messages. So there's all these aspects. So your medical team obviously is a key component of your survivorship plan, and that includes your oncologists, your urologists, your family doctor, the nurses, various types of nurses that you may encounter, your pharmacists, and there's many other, there's dietitians, etc. Too many to mention in this presentation. Financial factors, I have a slide on this coming up, but how is the cancer diagnosis going to affect you? Because down the road, you may miss time from work, or you may not be able to do certain aspects. Your age is obviously another major factor in your overall survivorship. Your attitude of mental health, and anybody that's listened to the news recently over the last couple of years, mental health has taken off as a very high priority for most governments and most health organizations. So we want to help with the attitude and your mental health to help you get through your overall cancer diagnosis. Your physical condition, do you have high blood pressure or other underlying conditions that are going to affect your cancer and the type of treatment you have? Then there's their patient engagement, as I mentioned. It's patient-centric or patient-focused. So the decisions that you make and how your healthcare team incorporates your decisions and your wants and recommendations. And unfortunately, one of the other aspects of your survivorship is actually the geographic aspects. Are you in an urban, rural, or regional center? So obviously, if you're in a more rural setting and you don't have access to a primary cancer center, or you can't travel, you're going to have a different type of treatment option than if you're in a more urban area or you're accessible to a center of excellence, as they call it in some provinces. So with all these, you can develop your survivorship plan. We talk about getting communication and understanding your diagnosis. So where do you get this information? So in some of the studies, they say about 67%, 2/3 of the information comes from your oncologist or your urologist. However, the same studies point out that you have between 5 and 12 minutes typically with a urologist or an oncologist. So you have to really maximize that time. They have to give you the diagnosis, they have to give you the recommendations, and there's not a lot of time to gain more information. Fortunately, some of these healthcare professionals have nurses that may spend up to a half hour or some extra time with you after that appointment to go through a little more detail. But again, it's limited how much information you can get at one doctor's appointment. Fortunately, over half the patient population that we surveyed says they got a lot of information from our own website, the Kidney Cancer Canada website. And as Christine just mentioned, this whole forum and other information will be posted. So there's also other support groups. We're not the only support group, but we're probably the primary one in Canada, and hopefully your first line of access to information. Then there's your family doctor. Again, the family doctor has a lot of information, but they may not always be up to date on the latest and greatest treatments. We talked today about SBRT. Not all doctors are aware of the new gains in that. There's new drug regimes. There's so your family doctor, depending on how versed they are. And unfortunately, or fortunately, not all family doctors see too many kidney cancer patients. So if you're in a more rural area and they see 1 or 2 kidney cancer patients every year or two, they're not going to research all the latest and greatest treatment options that you can have. So this is a great opportunity for patient support groups like ourselves, Kidney Cancer Canada, where we try to get more information on these psychosocial aspects and provide that extra support and treatment to the patients and caregivers. We're developing caregiver support materials that we'll be able to give to your family doctors and access in other places. So we also did surveys on what patients will be willing to do to meet their treatment goals. So a lot of it is the regular visits, so attending a cancer center. So if you're in a more rural or a suburban area, you may have to go to a downtown center or a regional center. You have to attend the time. We promote clinical trials, so it's good to attend a clinical trial because you may be on that next wave of treatment options. There's also the travel component I kind of alluded to earlier. So some patients are willing to travel across the province or across the country. And even you hear of people traveling out of country to the States or to Europe to get treatment options that aren't available to them. The flip side of that is, what are the barriers to care? And there's side effects. So different treatments have different side effects. There's delays. We all know what happened through COVID when hospitals shut down certain surgical procedures and what have you. So now they're all catching up. Hopefully they're more prompt in the future. But there's a barrier to actually getting the treatment you needed. I talked about the rural and the more remote areas. So there's certain treatment options that may not be available to you just from where you live. So we talked about SBRT and how not all hospitals and not all centers will have the technology to do SBRT, but then there's robotic surgery, laparoscopic surgeries, things like that you may not have access to unless you get to another hospital or another regional center. There's delays, there's the financial burdens, the loss of independence. So there's many factors that we understand that become barriers, and these all have to be incorporated into your survivorship plan to make sure that there's ways of addressing these barriers and working around them. So I wanted to spend a second on financial concerns. So we talk about treatment options, and there's preconceived notions on how expensive these drugs are. Now, the majority of these drug trials are combination drugs, which is even adding higher costs because you're not really paying for one drug. Now you're paying for a combination of drugs. So, and this isn't a forum to talk about whether the drugs are priced right or wrong, and that, but to acknowledge that there is a significant cost to these. So, how do you pay for these treatments? Do you have a copay? Do you have company benefits? Are there caps on your benefits? Are there copays or deductibles? And are you able to afford those copays and deductibles? Would you take or rule out a treatment option due to the cost? So if you're offered 3 or 4 recommendations, unfortunately, you may or may not be able to take one of those recommendations due to financial reasons. So we do acknowledge that some people have trouble affording the medications, and in Ontario we have Trillium and other programs that could help mediate that. Other provinces have similars, but there's not always the funds available for the high cost of medication. And then on top of that, it's not just the medications. If you're off work for a period of time, are you still able to support yourself and your family? So there's these implications on how can you afford to put yourself through not only paying for the drugs, but if you've missed time off work, you have other costs. You now have increased, if you're going to one of those regional centers and you have to fly or drive, if you have to stay overnight, there's all these aspects that may not be covered even by your copays or your deductibles, because you have to stay and feed yourself when you're, say, in Toronto, but you're from Northern Ontario. Another aspect of the survivorship plan is what's your priority and what's the goal? Is it length of life versus quality of life? And I know these are hard decisions, and a lot of time and effort has to be spent with your healthcare providers to discuss these aspects. And these will be influenced by your age, your disease prognosis, and the other factors I've previously mentioned. But they all take an important step into defining your survivorship plan. So again, there's other aspects of cancer. We've talked about the physical, so it's just the ability of doing your normal day-to-day routines. There's exercise, things like that, plus the surgery and the aspect and what happens after surgery as you recuperate. But there's the psychosocial aspects. There could be spiritual and existential effects on how you relate if you're a spiritual person, and the questions that you may or may not ask yourself after you've been diagnosed or after you've had some side effects. I talked about the financial aspects. So there's loss of income. There could be limitations to your work or school performance. You may not have had to leave work for an extended period of time, but your productivity may not be what you used to, and your coworkers or your boss or the company may look on that positively or negatively if they're supportive of your cancer treatment or if they're not. There's also change in roles that have to be looked at. You may have been the primary caregiver to a household, taking care of the kids, running them to and from their activities, or what have you. But now that you're the cancer patient, your partner may have to take over some of those roles. And where you used to care for the family, now the family's taking care of you. And that can have different aspects and changes within your mental and physical state. Talking about the mental state, there could be fear of recurrence, and there's always that living with uncertainty. You may have had your surgery and you're told to come back next year and the following year for follow-up scans, but we all talk about scanxiety and the fear of that, will it come back? And after that 5-year scan and they say you're good to go, that doesn't mean the uncertainty leaves with that last scan. You could also have complicated comorbidities and how these impact your future healthcare requirements. You may have to deal with the side effects plus maybe high blood pressure or other aspects, and you have different drugs that negatively impact each other. And ultimately, there's that sense of mortality and the fear of death and how that affects your overall well-being. So all these aspects have to be taken into account in a survivorship plan. And some of the key aspects also are planning for reoccurrence and screening for secondary primary cancers. So you've gone through the system, you've waited for your first regimen of treatment, but you want to also understand what happens if there is another reoccurrence. So I mentioned there could be longer term side effects that didn't materialize right away and late effects of the treatment. So how do you handle these? And with the survivorship plan, there could be a roadmap of how to re-engage your healthcare professionals to look into these aspects. The survivorship plan should also have an overall health promotion aspect. So weight management, how much physical activity you can do. Kidney Cancer Canada in the past has published a book or pamphlets on what exercises you can do after kidney cancer surgery, because you can't really exercise your core, but you still have to remain physically active. So what can and you cannot do? Again, looking at your diet, how much do you need to change some of your habits? Smoking and alcohol are always the top ones, but there's different aspects of diet that you may or may not have to change. Again, your survivorship plan has to look at that social well-being. Are you prone to depression, or could your prognosis cause depression or other anxieties? After the fact, do you have PTSD that you have to deal with? We mentioned the fear of reoccurrence. Return to work, how do you handle yourself when you go back to work? I mentioned productivity. How are your coworkers going to interact with you? Are there financial issues? You may have lost months of work and months of income, and that puts financial strain on the family. And then there's body image, and we also talked briefly earlier about sexuality. Is the treatment going to affect how you interact with your significant other? So some of the principles that should be included in your survivorship plan is it needs to be risk stratified, because there's not just one path. And as things happen in the future, as you're going through your survivorship, there's different risks of reoccurrence. There's different risks of other aspects happening. So you need to incorporate these different options in the survivorship plan. There should be treatment summaries. So if you don't get back to your primary health care professional down the road, you end up in another doctor's office. They should be able to see and understand what kind of treatment you had and what the care plan was and how they can adjust to what they're looking at today versus your overall treatment plan. So again, there's information and education of the patient and the caregivers so that you understand the choices and you have the confidence to enact that survivorship plan. Again, I mentioned some places, and after COVID especially, it took a long time to see a doctor and get your surgery or get into a treatment plan. But if you do have a reoccurrence, you don't want to have to wait that same length of time. Is there a means to rapidly re-access those doctors that treated you the first time? And then there's also an aspect now with COVID, we learned how to, like today, we're on this virtual conference. So the doctors now can have some remote monitoring and coordinate your care without having to actually come into the office, especially if you're one of those rural patients that made their way to one of the more urban cancer centers. And of course, we talked about the caregivers, which are sometimes coined as the other cancer survivors. And they have a lot of the same problems and the same factors that we talk about with the patient. They may not have had surgery, or they may not have the side effects of a drug regime, but a lot of caregivers still experience fatigue, insomnia, loss of physical strength, loss of appetite and weight, depression, anxiety, PTSD, fear. And again, your caregiver may lose their income because they're spending more time with the family and more time with the caregiver, with the patient, that they're not able to work as much or have taken time off work to do some caring. So there's all kinds of aspects that we also have to look at on terms of the caregiver. So when you wrap all this together, we need a survivorship plan, but it has to be personal and individualized. So no two people will have all those same aspects, be at the same stage. So it's going to take into account your age, your sex, your annual income, marital status, geographic location. All these aspects will become factors in how your survivorship plan will be structured. And again, the day after you've seen your healthcare professional after your surgery or a regime of medication has stopped, you don't write a survivorship plan and leave that in place the next 10 years. It's a live document. It's fluid and always evolving. So as your health changes, as your life situation changes, your marital status may change, or you may move, so you have a new geographic location. So your survivorship plan has to evolve. And it's also, to some extent, cyclical, because as you have your annual or your periodic meetings with your healthcare professionals, you may have to update it. One thing about the survivorship plan, too, is it has to be realistic. The person that's living that survivorship plan has to be bought into it and be able to accomplish whatever the goals are, whether they're the dietary goals or the physical goals or the mental health goals. So it brings in those emotional factors and those clinical factors. And you, as the patient, and your caregivers need to actively and continuously address that survivorship plan. It's not something you may have to do every day, but you have to make sure that you're on track to meet those objectives. So as a call to action for Kidney Cancer Canada and other types of organizations that support patients, we have to start lobbying more for inclusion of care treatments. There are certain cancers in Ontario, for instance, that have a more structured survivorship plan in a component in the treatment. But today, within Canada, there is no survivorship planning. It's something that is talked about. Some doctors do it as an aside, but there's no formal requirement. So we need to lobby to have this as part of the healthcare services that we get. And it also has to be longer than 10 years. So a survivorship plan, as we said, is till end of life. So if you're only going to get scans till 5 years from your first surgery, it may not be long enough to have those interactions with that healthcare professional who helped you devise the survivorship plan. So we also need to promote more research. There has been some research, but not enough. And then we need to educate family doctors and local clinics on survivorship plans and how to leverage those when they see you for your annual checkups and any other medical concerns that you go to visit your doctor for. So with that, we can take any questions.
Andrew, that was excellent. Thank you. You know what? This is something we don't talk about enough. It brings a whole different aspect of, quality of life, your care plan, and just actually being diagnosed and living with kidney cancer. We often don't pay attention to these very, very important topics. So thank you so much for bringing that to light. I actually I've heard this a few times, and I actually heard more this time. Like, there's something new every time. So thank you. And we do have a question. Please share in the Q&A if you have something. I wanted to comment, you said a call to action on the survivorship, on quality of life. And I might be letting the cat out of the bag, but I just wanted to share with our patient community, and I haven't told you this yet, Andrew, because I just received it. There is another research study that is being proposed, and Kidney Cancer Canada has been invited to be an important part of this, and it is exactly on survivorship and quality of life. And so it's done through a few of the major cancer centers in Canada. I'm not sure all of the details yet, but we will certainly be sharing with them to you. And sorry, once again, there might be another survey that's coming your way, but I can't say how important it is. I know they're tedious sometimes, and you think, oh gosh, not another survey, but we really do appreciate it, because it gives us this kind of information that we can help you going forward and make treatment and care better. So
Yeah.
thanks for that, Andrew.
No, you're welcome. And that's great news that there's more research done. And just to follow up with the questionnaires, we're a patient support advocacy group, and we try to represent the patient. So that's why we have these questionnaires, to get to the root of what you're thinking, what your needs are, what your expectations are. And that way we can work with the provinces, the local healthcare professionals, the medical communities, to make sure that we are your voice. So although, as Christine said, it could be a lot and tedious questionnaires, but that's the only way we can promote what you're thinking. And we advocate to be your voice. So we need to make sure that you are telling us what you're thinking, what your needs are, what's working, what's not working, and what you need to. And that's part of that whole survivorship plan, is how we as a patient organization can work with you to make sure that you're getting the best treatment possible.
It's really key, isn't it? If we want to make a difference, we need your voice to help us make that difference.